All right. Well, welcome everyone to our knee pain Egoscue workshop. I'm Zach Beers, the clinic owner and therapist here in Seattle. And Kelly's down in Portland. She'll be co-teaching with me today, but I'll just introduce myself real quick. So I've been doing this for about 8 years now. I started, I first learned about Egoscue when I was in college, actually. I studied exercise sciences, I did personal training, and was trying to figure out what I wanted to do career-wise. And I was introduced to the Egoscue method through one of my professors, and it had been a lifesaver for him and his back issues. And so he introduced it to me, and right from the get-go, it made a lot of sense. Just the whole idea of it really resonated with me, and I like the idea that we could use exercises and stretches to help people naturally overcome their pain. And but of course, at the time, being early 20s, I just thought, oh, this is something for old people. Like, this is something I'll use for my clients as personal trainer, but nothing I need, right? I'm invincible, and right. So, I started playing a lot of racquetball in grad school, and I kept hurting my shoulder and my back, and started getting some tennis elbow. And so I thought, well, maybe I should give this stuff a shot. And sure enough, I got my posture photos taken, as we'll show some examples today, but I got to see how my alignment was totally off, and I was twisted, and my shoulders were rounded, and my feet pointed out. And it just really made sense. Okay, well, racquetball is not causing my pain. It's just the body I'm bringing to the court is out of alignment, and that's really the crux of it. So I started doing the exercises right away, felt improvements, and got me out of pain, kept me playing racquetball. And so I was sold, and then decided to get certified. And I found a job in Portland, actually working with Kelly and her husband, Martin, clinic owners there. So I worked there for a little bit, got some experience, and then I moved up to Seattle 6 years ago. So I've been here running the clinic in Seattle for the past 6 years. So that's me in a nutshell. I'll let Kelly, why don't you introduce yourself too?
Gosh, I can't believe it's been 6 years you haven't been in Portland. We still miss him every day. He's doing such a fabulous job of helping all the people in the Seattle and Washington area get their lives back, and using exercise and Egoscue. So we're so grateful to have a Northwest partner up there above us. I'm Kelly McFarland, and my husband and I, Martin, co-own the Egoscue Portland Clinic, and we're going on almost 20 years here. I can't believe it, in one location down here in Portland. So I think at this point in my career, I'm just so full of gratitude and just so much passion and love still for the method and for my clients that come in. And I mean, I just see so many miracles, such magic and miracles every week with people who are committed to their health and their wellness and an alternative approach, who've been through everything, tried everything, haven't got the results that they've wanted, are looking for an alternative. They hear about us, they come in on a whim, on a hope, and find that the number one thing they always say is, oh my gosh, where have you been? I wish I would have known about you before X. And I'm just so grateful to be on people's journeys and help them along that path of health and wellness and getting their life back, becoming active again. Because that's how I got into it too. Just like Zach, like I was a personal trainer. I had neck pain chronically from being a childhood athlete, and then kind of retiring at 16 after 13 years of being a gymnast. So I was very active, then went very inactive, and then of course was studying all the time, and kind of got that typical like tech neck book pain, studying neck position pain, posture. And so I had neck pain, and I got exercises for my posture, changed my posture. And I just remember the really pivotal moment for me when I was doing the method, very like maybe my first 6 months into doing the method for my own personal use. I just remember laying there thinking, wow, these are the tools for a lifetime. And I really am completely empowered with these tools for the rest of my life. And I don't really need to rely on anyone unless I really can't figure it out myself. And if I do, I'm part of a big fabric of people and a community that I can rely on for health and wellness. So those people and this method have supported me and my body and my posture for 20 years. And there isn't anything that I haven't been able to handle without these tools or with these tools. So I'm so grateful to be here today and share that with you.
Awesome. Thanks, Kelly. All right, let's play this. Okay, everybody see my screen now? The slides? Yep, okay, great. All right, so first off, the Egoscue method. Pronunciation is always a little tough, so you'll hear us say it a few times, Egoscue. It comes from our founder's last name, Pete Egoscue, came up with this method. You can read about his story and things in any of his books. We won't go too in detail to that today, but this, one of the main things that sets us apart, I think, is the way that we look at pain. And so, the way I see it is it's a signal, it's a warning, it's a way of your body communicating with you that something's wrong in a simple sense, right? So just like in our cars, when something goes wrong, typically check engine light comes on, and hopefully you don't ignore it and you investigate and figure out why it turned on, right? And then fix the problem, and then the light will go away. Well, the same as with our pain. If we don't want to just turn off the signal, right? We don't want to just mask the pain, whether that's through drugs or other things, but we want to really fix the reason the pain was there in the first place, right? So it'd be the equivalent of just covering up the check engine light or unplugging the bulb that made the light come on, instead of going to the root cause. So I think intuitively we all know that, right? Like we want to fix the cause, but unfortunately a lot of our Western medicine now is very focused on the symptoms and not necessarily fixing the cause. And so at Egoscue, we look at, the why, what's driving that symptom. And it's not always as obvious as, oh, your knee hurts, there must be a problem with your knee, right? It doesn't necessarily mean there's anything wrong with your knee. That's just your body's way of telling you something needs to change, right? So a lot of people blame their pain on their age, their genetics. Oh, my dad had a bad knee, my grandpa had bad knees, so it just makes sense I have bad knees. Well, that's usually not the case. I mean, as far as I know, we haven't found any knee pain genes yet, or even arthritis for that matter, although it can have some hereditary potential. Most of the time our pain is due to our lifestyle things, and of course injuries happen, accidents happen, but generally speaking, the chronic, ongoing stuff that most of us probably in this chat are dealing with can be related to the position of our bodies, and we'll talk about that in a minute. But the age is another good one. People blame, oh, I'm just getting old, I've got old knees, and usually it's one knee is worse than the other. So you always have to ask the question, okay, well, if your right knee is the same age as your left knee, right? So why is the right knee worse, or why is there more arthritis on the right knee? So there's something else going on that we need to address. And so for us, we look at the posture or the alignment, and meaning not just, most people think of posture as they're just pulling their shoulders back and having a straight neck or whatever, but it's really the whole body. And so just like this house, it's crooked in a lot of different areas, and it's not very stable, right? It looks like it's just one bad or strong wind blow away from falling over. So our bodies are the same way. If they're not stacked up properly, all those structural joints that we'll talk about are not doing what they're supposed to in the right position, then it can really leave us weaker, more susceptible to pain and to injury, and just more wear and tear in general. So don't have to read that whole lengthy description, but basically it's just, as I said, posture is encompassing the whole body, and it's supporting all the structures. So we're just focusing on the knees, but really your whole body is affected by posture, not just your muscles and bones, but even other parts, other systems in your body too. So it's all about balance, meaning right and left side should function the same. They should work the same on both sides of your body, regardless of the position you're in. So we look at standing posture just as an easy way to assess, but there's a sitting posture, there's a squatting posture, every movement we do could be a way of looking at your posture. So we're designed to move. That's what our bodies are built for. That's how they thrive, is with movement. And when we stop moving as we get older, I'm sure most of us were, as we were younger, we're moving a lot more, both just by playing, but we were probably more active. And we can try to keep up with physical activity as we age. Obviously, we can go to the gym, we can go for runs or walks, or even play sports still. But overall, we're just not moving as much as we need to, or as we used to, because most of the time we're sitting, right? We're at our jobs, or we're sitting in our cars, or we're on our phones or computers, which just really restricts all the movement that our bodies need. And so we develop these problems related to that lack of movement. So, all right. So eliminating the pain, as you can guess, we want to get to that root cause, like I talked about earlier. So now, none of these things are bad. Some people think, oh, Egoscue is anti-surgery or anti, medicine, which is not true. It's just we want to make sure that we're actually treating the cause of the problem and giving you a long-term solution with as few side effects as possible, right? So sometimes drugs are necessary, sometimes surgeries are necessary for sure, but we still want to make sure that we're addressing that underlying cause, because you can go have a knee replacement or have your meniscus repaired and things, but your body's you're gonna have the same posture, the same movement patterns, the same muscles as before the surgery, right? So what's gonna stop it from happening again? Or maybe your other knee might start to have problems, or your hips or something else. So resting obviously can help, but you can't rest and relax forever, right? You gotta use your body, and if it hurts to move and things, then we should probably fix that and not just avoid the movement. And same with our sports. Like, I could have given up racquetball because I only hurt when I played racquetball. So logically, I could have said, oh, well, I'll just stop playing racquetball. I guess I'm just not built for it, but which isn't true. Our bodies are designed to do that kind of stuff. So, all right. So enough from me. I'm going to let Kelly take over here and talk about what posture means and how to assess it. And we'll show some examples and help teach you guys a little bit about how to start to identify some of this stuff that could be causing your knee pain. So take it away, Kelly.
Great questions in the chat. Keep that going. While I'm talking, if things pop up, just throw them in there. So I always like to start off the posture section of this just by reminding people that, hey, your posture right here, right now is like a snapshot in time of everything you've done up until this point. All your activities, all your habits, what you did for a living, what position you were in when you were working at your job, X amount of hours a day, any accidents and injuries that you've had, they all add up to the posture that you're in right now. So if we were to take a picture of your posture like we do when you come in for your visits, you would get a chance to see in entirety, like, well, what you've been up to, right? Posturally. And so when you come in and we take your photos, we compare them to this picture right here. And this is just the picture of an aligned body out of the textbook, and all 8 load-bearing joints, shoulders, hips, knees, and ankles. From the front view, we're looking at, are the shoulders level? Do they sit level and on top of the pelvic girdle that's level? Are they square? Are they straight? Is there any rotation? Do the knees point straight ahead? Do the knees sit on top of the ankles hip width? Are all those 4 load-bearing joints on each side, are they in alignment with each other? And then the arm position from the side, from the front view, can you see the thumb and the side of the pointer finger? Or do you see like all 5 fingers in the front view because your arms are, rotated forward and your shoulders are rounded? So when you come in for your first appointment, you really start to step into bringing your posture conscious out of the subconscious mind, because it's stuck in the subconscious mind most of the time. You're not thinking about your posture, you're just living your life, and your body is coordinating your muscles to do what you tell it to do all day long. So when you come in, it's a really big first step in saying, oh, wow, this is why I'm having the pain and the limitations that I've been experiencing. You get to see it, you get to witness it, you get the light bulbs go off, go on, like, wow, okay, like this totally makes sense. And so the side posture, you want to be looking at it. Okay, is my ear over my shoulder? Is my shoulder over my hip? Is my hip over my knee? Is my knee over my ankle? Do I have a nice S curve in my spine? Do my hands hang down at my side? And all of these balanced positions in the front view and the side view add up to more function, more balance, more endurance, more strength. The more aligned you are, the more function you have. So the pictures, and when we start to kind of look at our posture here in a bit and start assessing ourselves, it gives us an insight into curiosity and questions of like, oh wow, like what is going on and what does need to be realigned and what muscles are working and which ones aren't, because the only way that your posture would deviate from that original design or that textbook picture is by the muscles telling the bones what to do. So that's the only way it works. The bones don't tell the muscles what to do. The muscles tell the bones what to do. So, if the muscles have been telling the bones, especially particularly in the knee, that, like, for example, like if I have had this happen with lots of clients, they've ridden horses for their whole life, right? So you can imagine, and everybody can kind of get a picture in their head of what that leg posture might look like. That leg posture is fairly bow-legged, right? And so what happens over time is those condyles, like that in the knee, just like this picture, they should sit right on top of each other and stack equally. And the ligaments and tendons and muscles hold that in place. And the knee is kind of an interesting one, like the elbow in a lot of ways, because it doesn't really allow for a lot of range of motion. There's very limited range of motion in the knee joint. The knee joint is very dependent on the hip movement and the ankle movement for its position and for its stability and for its function. So if the muscles in the pelvis are not aligned and not doing their job, and they are, biomechanically not doing the right thing or out of balance, then the knee is also going to be out of balance. And same with the foot. Like if you've had a foot injury in the past and you never reset the alignment of that foot and got the function of that sprained ankle or that broken ankle fixed, then the knee is going to suffer either on that side or the other side, because the body is a unit. And if function is lost in one part of the body, then it has to go somewhere else in the body. And a lot of times the knee is kind of like the catch-all. It can kind of take the brunt of things. But like I said, there's really not a lot of range of motion, and it only flexes and it rotates very minimally. But if it gets stuck in a rotated position because you rode a horse for many, many years of your life, it gets stuck in a rotation, and then you step on that and walk and move in that rotated position over and over and over and over and over time, it just wears and tears the ligaments and tendons and all of the tissues in that knee. There's very little room in a joint space because there's fluid-filled sacs in the knee that help cushion and pad and absorb shock. But anytime that there's inflammation in there and those swell even the slightest bit, you can see there's really not much room. So it gets tight and stiff, and then it fills with fluid. But the most interesting thing is one of the best things for the knee is movement, because when you walk and move, it actually creates a pump and it flows the fluid through the leg and through the body. So movement is really what the knee needs. And you've got to learn to train the movement so that it's balanced and aligned, and it's going to help, recover that knee. And so when you start looking at posture, looking at yourself, or maybe you think about other people that you see, out in public, from now on, you're never going to look at knees the same. I'm sorry to tell you guys, but you're forever changed after this. Anytime you see a knee that looks like either one of these, you're probably going to go, ouch, right? So the first one on the left, and you can kind of start to think about, well, what does my posture look like when I look in the mirror, or my husband's, or my grandkids, or, my friends? Do the knees come closer together and then out at the bottom? That's called valgus stress or knock knee, right? And the one in the middle is obviously one of the most severe ones and probably one of the most painful ones. You can see his left knee is pointing outward and bow-legged, and the right knee is actually going valgus, so it's inward. So his body is doing two different things at the two different times. It is not in sync. So I would say, oh my goodness, this man has a lot of knee pain. Not to mention a whole host of other things. What's interesting though is his feet are straight. The body is such a beautiful way of adapting to imbalance. Thank God, right? And then the guy on the very far right, he has what stress, what I was talking about earlier about if he rode a horse. Maybe that's what he did when he was younger. I don't know, but it's really common, even if you didn't ride a horse. Yeah, it's kind of that bow-legged appearance and the feet turning out. So with all that rotation in the bones and in the joints, in the ligaments and tendons, it causes wear and tear and, grinding and rubbing and breaks things down. But if we were to only just treat the knees and only the knees from now until forever, we wouldn't really get any better, because you've got to treat the body as a unit from head to toe. And we know that the knee is just a small part of a bigger chain of events, from the muscles at the pelvis, the muscles at the ankle. And one thing that I want to really emphasize too is that your upper body position plays a huge role in how your knees feel and how they function. So you can try this. If you're at your house and you have room and you can stand up a little bit, stand up and round forward, like get really hunchy, like hunch over, round forward, and then just kind of walk around all hunched over, exaggerate it, and feel the pressure into your knees and feel how it's hard to lift your legs and the pressure into your knees is greater. So just by having a rounded forward upper body position and your head hanging out over the knees and the lower body, it creates stress and pressure into that knee joint. So by changing that upper body and head position posture, it actually decreases the amount of pressure and stress into the knee. Okay, here's external and internal femurs. So you can see that when you look into the mirror, your knees are either going to point, like if you take your kneecap and imagine it being kind of like an oval, and then you put your finger right in the middle of that kneecap. And then what direction does that finger point, right? Or you can even take like little dot stickers and put stickers on the middle of your kneecaps and look in the mirror and look at what direction your knees point. They're either going to point straight, they're going to turn in, or they're going to turn out, right? And if you have like one knee that's turning in and one knee that's turning straight, or one knee that's turning out and one that's turning straight, that's an imbalance. That's a muscle imbalance. And there's usually a history or a pattern in your lifestyle that's created that over time. And once you start intervening with exercises and start training the balance, that knee that's turning out or that knee to turn in, that knee that's turning in to go straight and function like the other side, then you've alleviated the problem and things can get better. So there's always hope, no matter what knee position you have, foot position you have. Another really common thing that we see is, well, the body is an upright biped, and they're only ones, right? They're only upright bipeds. So you have to defy gravity. If you're going to stand up, right, in a gravity-filled environment, your body is going to follow certain patterns. And usually it does kind of a zigzag in space. Because it's got to keep your center of gravity. Your center of gravity is about 2 inches below your belly button. And a lot of people don't feel like they're standing centered or balanced. They feel kind of rounded forward. They'll feel weight in their toes, weight in their heels, weight on the outside edges of the feet, inside edges of the feet. They don't really feel that balanced. And that's a sign that, things are out of balance from the foot up. And when the knees turn in or the knees turn out, the lower leg bones will rotate and they'll kind of make a bowed appearance. And that's what we call tibial torsion. It's very, very common. It's just a compensation, a muscle imbalance. in relation to the position of the knees, the femurs, and then the position of the feet. So, but you can imagine walking around duck foot your whole life, not only would you have knee pain over time, but ankle pain, and you're also going to be putting yourself at higher risk for ankle sprains, ankle injuries, also tripping, falling, catching a toe on the side of your bed. If those feet are turned out, you're going to catch those toes all the time. So those are just things to think about, things that may be happening in your world that are completely related to your posture and your position. And now the light bulbs may be going off, going, oh yeah, that's why, that keeps happening to me. And this is also the flexion and hyperextension. We see this a lot in knees because when there's a lot of rotation stuck in the knee and the upper leg muscles are out of a balance, you're going to have a little bit more flexion in the knee. When you take your posture photos or you look at your posture photos from the side view, that knee rotates so hard, gets stuck there, and then it has to bend, it has to flex, it has to give in order to hold you up. It kind of looks like he's sitting on a stool that's not there, right? And I love Egoscue because Egoscue is so simple in the sense that guy, he needs to lengthen the muscles on the front side of his leg and shorten the ones on the back. Or excuse me, he needs to lengthen the ones on the back and the front on that left side. So he just really needs to balance out the muscles that are attached to his pelvis, his knees, and his ankle. And his upper body. I can tell his upper body's out of position just because of his hand position in that photo. But once he can align those muscles and get those bones in position, he's going to have way less pain and way more function. It wouldn't be very fun to be walking around like you're sitting on a stool all day. Ouch. And that's a lot of pressure on the knees, right? And then I suffer from this, the one on the right. This is one of my compensations that I work on. I was a gymnast, and so I have hyperextended knees for sure. And that's just a function of the muscles on the back side of the leg are really long and kind of underdeveloped, and just they're not holding up their end of the bargain. They're not doing 50% of their job. And the ones on the front are doing too much, and the knees kind of hyperextend backwards. And that can put pressure in that condyle position. It kind of pushes it backwards and puts more pressure onto the front side of the knee. So you would say, hey, we probably have pain in the front of the knee in that picture. Okay, now it's your turn to start putting on your posture goggles and see what you see. What do you see? And you can unmute yourself or raise your hand and we'll pick on you. Or you can just unmute and shout it out. It's fine too.
Put it in the chat if you want.
Yep, put it in the chat. Don't be shy. No wrong answers here. We can start off by asking the question, well, does he have varus knees or valgus knees? Anybody? Okay, I'm just going to pick someone then. I like to be feisty. See, it's got to be someone who's got their picture on. How about Nicole or Patsy? What do you think, valgus or varus?
Valgus is when the knees come together and the feet go out. Varus is kind of the bow-legged, where the knees are wide and come out relative to the ankle.
Well, I think it's the latter, but his knees don't exactly match there, left and right.
That's right. Awesome. Way to go. Way to become a posture therapist. That's what we want.
And you can see not just in his knees, but in his shoulders. His left shoulder is higher than his right shoulder.
Mm-hmm.
Yeah, and he's not centered on that line. I think that's why the knees look different, is because he's kind of shifting his weight to his left, right? So that red line should be right down the middle, and it is at the bottom, right? That's where we reference, is at the bottom between the ankles. But by the time that line gets to the knee, you can see his right knee is close to the line, his left knee isn't. Same with his pelvis, same with his shoulders. So he's definitely favoring one side. So yeah, well, what else besides the knee? If we look at the whole picture here, what else is off in his body?
In his right, not only his right shoulder's dropped, but his hand, and then on the picture to the right, he's tilted forward.
Mm-hmm. Yep.
Everything's forward of the axis.
Yeah, exactly. So someone in the chat said tech neck or tech neck. Yeah. So the head is forward. But really we just, once again, can't look in isolation. If we just look at his neck, yeah, it's forward. So does that mean we just need to strengthen his neck and pull his head back? Well, not really, because everything below it is forward too. So his head's really not that far forward from his shoulder, right? But his whole upper back is rounded. His hips are forward of the line. So yeah, we got to get all those joints stacking up with each other. And you can imagine how that affects the knees, like Kelly was talking about. Shift all your weight forward like that. Now, instead of gravity, the weight of your body going straight up and down all those joints, it's like this. So now you've got more pressure on different parts of your joints, and the muscles too, on the back of his body now have to work harder just to keep him in that position, holding tension there. So let's see, we're seeing all of his fingers, the shoulder roll. Yep. So in the front. So remember, we should see just the thumb and the first finger from the front view. And if you see more than that, it's because the arms are rotating in or forward. And so then the hands become more visible from the front instead of being at the side like that. So good. Anything else?
Yeah. I mean, it's always good to hypothesize, like, what do you think he did for a living, Or what sports do you think he played that could have created these imbalances? I can take some pretty good guesses, right?
Yeah. So let's see what he looks like a few weeks later. So
Same guy.
Yeah, same guy. He's got a shirt on now, but it's same guy. I can promise you
His
that.
knees are,
What
Yeah.
was that?
What was it, Mom?
his knees are better.
Yeah.
His hands, look at his shoulders even. This one's a little bit, but not as much as it was.
Right. So
Now, his knees might not look straight, but they're both equally bowed in the same
Right.
direction, in the same plane, right? That is way more stable than having one knee in one direction and one knee in the opposite direction. So what happens is the body will balance it out, and then it will start to correct the bilateral imbalance, because it's not as hard at this point to change this leg position versus the one going one way and one going the other way. So balance always trumps. If one side looks like the other side, you've got more balance than you ever had with one going one direction and one going the other direction. That's really unstable. So his balance was probably quite off in general. So if he did play a sport, he probably had some imbalances when he was swinging or shooting or whatever it was. He had some limitations there. He had to have.
yeah, and look at the side views too. Not leaning forward like he was there, right? So
Another good test for yourself is, can you stand on one leg? Like when you go to stand on one leg, how balanced is it? Does that knee wobble? Does the ankle wobble? Where does the knee go? It's going to be very different right to left if you have knees that are pointing not straight, but out or in. And then another thing is if you're going upstairs, pay attention to what direction your knee goes when you're going up the stairs. When you go to take a step up, does the knee dive in? Does it shoot out to the side? What pattern does it like to follow? What compensation is it, stuck in? Because it should go straight ahead and track right underneath the ankle, right underneath the hip, and go right up the stairs in a nice straight line. Yeah.
All right. So I'm just going to show a couple other before and after so you can get an idea of, how the body can change, because this is all muscles, right? This is what we're doing, is the Egoscue method is all about getting the muscles to do what they're supposed to do, basically. So exercises and stretches can change your posture. And so we see this guy on the left with the lighter shorts was before, and then with the darker shorts was later. And this guy had knee pain, and I'll let you guess which side you think he had pain on, just one knee. If anybody wants to guess based on this picture, what do you think? Or which knee looks the most out of balance, would you say? These are sometimes hard to see. So it was his right knee. So you can see this one is pointing out, the bit more than this one is. They're both turned out a little bit, but the right's definitely worse, and his right foot also is turning out more. So just like Kelly talked about, the knee's basically a hinge. It's supposed to flex and extend, bend and straighten, but if it's turning out like that, now every time you bend and straighten it, you're also asking it to twist a little bit, right? Because you're moving forward, but yet your knee's pointing out like that. It's kind of like driving around with your tires in your car pointing out, right? It's not gonna last as long. So once we corrected that, you can see now knees and feet look pretty good, pointed straight forward. That his knee pain went away. So, and he's a pretty active younger guy. You can see from the side views too, lots of improvements he made, like in his shoulders. Look at how forward his shoulders were. You can see all of his back exposed behind his arm, not so much afterwards. And his head, you know, the ear is on the line now like it should. So whole body approach is what it takes really to restore that balance, and pain typically goes away.
And I should say this too, before we go any further. So, you know, when you come in and you start learning about your body and your posture, it's a real wake up call into, oh my gosh, I had no idea that my body was in that position or doing those things. And the first thing that people think of is, oh, I'm just going to stand up straight, or I'm just going to walk with my feet straight. I'm consciously just going to do that, and it'll be all fine, and it'll be better, and my pain will go away. Not the case. So think about if you were to just turn your feet straight, but your knees were still pointing out or in, you're going to actually create a new imbalance and cause pain. So that's not the right approach. And you're also going to get very, very tired trying to stand up straight, because if you just pull your shoulders back, the rest of your body's still out of alignment underneath it. So you're just going to get really, really tired, and you can also cause neck or low back pain. So the real, you know, long-term approach is like Zach said, to treat the body as a unit. And when you have Egoscue exercises, when you have a personalized program, or you're doing exercises out of the book, those exercises treat the body as a whole, as a unit. They treat the body from head to toe. It doesn't leave anything out in any of the exercises. All of them are good for you as long as they don't cause you discomfort. You know, that's an important thing to say. Don't just, after this workshop, just start walking around with your feet straight, because you can cause issues.
Yeah, there's reason they point out in the first place, right? We have to change the muscles that are putting them there.
And there's a lot of years behind that have built up to the posture that you're in. So it's a process over time of straightening and strengthening the body back into alignment. It doesn't happen overnight, but you can feel so different and have tremendous results in even just one session, and even just one application of doing the exercises.
Yeah. So here's a good example of that, pretty extreme example, but just to show how, you know, even these extreme cases can improve, you know. And this lady obviously stuck pretty bent over. And I think this is from our Japanese clinics, and they, I think the story was that she was worked a lot in the field as a farmer and bent over a lot, and so her body just adapts to that, you know, as it should. But then obviously that causes problems. You can imagine the condition of her back at that point. But her knees too, look at how bent her knees have to be to offset that really bent over spine, right? So now her knees are taking a lot more stress. And so it's never too late, you know, regardless of your situation, your muscles, as long as you got a brain and muscles still, you can probably change it. So
that's my favorite quote. And you can imagine what her gastrointestinal system was like. How hard was it for her to breathe in that position with her lungs compressed, her heart compressed? She's at a really high risk of a heart attack here, and constipation, and, you know, falling. I mean, so many things come into play when your posture is out of balance.
Yeah. Okay. So now for the interactive part, we're going to have everybody, if you don't mind, standing up. And if you're wearing shoes, take them off. Just take them off real quick. Socks are fine. But if you want to go straight barefoot, that's also good. All right, so this is a little self-assessment we can do quickly. Normally, if you're a client, you know that we take posture photos, but we also like to do this because it gives you some awareness of your own body in the moment. So just kind of stand in place, march, take a few steps in place, maybe shake out your arms a little bit. Don't look at your feet, just kind of put them, let them settle wherever they feel natural. And then maybe even close your eyes so you can focus and just kind of let your body hold still for a minute, and then tune into what you're feeling on the bottoms of your feet. So notice specifically where the pressure is. You know, is it, first of all, is it the same on your right and left foot? Or maybe you feel heavier on one side? And then where on the foot do you feel it? Is it more on the front, like on the ball and toes, or is it back on the heels? Maybe it's more on the inside edge or the outside edge. So just kind of get a sense of that, you know, where, and you may find that you move around a little bit, which is fine, but where does it tend to settle? So does anybody care to just share what they're feeling real quick? Because we're probably all feeling something a little different.
Also, if you can't stand and you're seated, you can also feel into your butt bones, into your seat, and feel like, do I feel heavier on one butt cheek versus the other? You know, that kind of thing.
Yeah, so what's everybody feeling? Anybody feel completely balanced? Like same thing on both feet, equal front to back, right to left? Yeah, maybe a Val. Anybody, so who feels something that's different? Who feels something different on one foot compared to the other?
Heavier into the right foot and more heel and ball of the foot.
Okay.
Good.
And it's also interesting to correlate your weight distribution in your feet. Is the side that feels different, feels like more heel, more toe, more inside, more outside, or more heavier altogether? Is that the side you have pain on? Or is it the opposite side that feels that way? So there's reasons for both.
Heavier on the side that probably has a little bit of pain.
Yep. Okay. And so that lends to like, well, why would I have, you know, an imbalance over there and pain over there? You know, what's going on that side, posturally, positionally? You know, is that side taking more of the workload, or is it more out of alignment? And then that's causing the pain. So a lot of times your symptom isn't where the posture is really the most off, and sometimes it is. So everybody's body is so different.
Yeah. So just kind of take a mental note of what you feel right now, because we're going to check it again in a couple minutes. But what it should feel like, I mean, if your body is balanced, you would expect to feel the same thing on both feet. First of all, 50-50, right to left, and front to back. So basically on the heel, center of your heel, and across the pad, like the ball of your foot, from the big toe to the small toe. So that whole pad should be pretty even on the floor, and you want it about 50-50 front to back. So on the heel and the ball equally. So if it's anything different than that, it just tells you, okay, something's not quite stacked up ideally in your body, and it could be anywhere, you know, but when we look at your posture, we can get more details, but that's just a clue that you're out of balance. So we're going to try a couple exercises now to try to restore some of that balance. And just as a caveat, you know, obviously we're in a group setting here, so it's not all these exercises may be the right ones for you individually. So if you have any pain or anything, just stop or let us know. We can modify them, but we tried to pick some that were just kind of generic to let everybody get a sense. But these are not necessarily the best exercises for your specific body. Okay, we're not prescribing these. But all right, so the first thing we're going to do is we'll just need to stand up, and if you can use a wall, great. If not, you can just do it freestanding like this, but I'm going to use a wall since I have one. And I'll give you a close-up look at my hands here. So we're going to make what we call the golfer's grip. So your hands will go like this and just tuck your fingertips in. So it's not a closed fist, it's kind of an open fist. You know, thumbs are out, fingertips are in. Okay, so then I'm going to stand at the wall and get my feet pointed straight ahead on the ground. Let's see.
Straight ahead means the space between your second and third toe and the middle of your heel. And then you want your feet to go right down underneath your pelvic girdle, like the pointy hip bones in the front of your hips. That's where your middle of your foot should be, right underneath those, not the outer part of your hips. It's right here, okay?
So I'm going to stand right up against the wall. So my heels are touching, my butt's touching, upper back and head in that golfer's grip with your hands. Gonna go right behind your eyes on your temples, and then bring your elbows in front of you, try to touch, and then back behind you, try to touch the wall behind you. Now you may not be able to go that full range of motion yet. That's okay, just go as far as you can, in and out. Okay, let me get a look at what everybody's doing. So the idea is, yeah, put your knuckles just behind your eyes, not all the way on the back of your head, but just kind of on your temples. There we go. Nice. Easier said than done, huh? It's like Val's done this before.
Hey, I'm seeing some elbows getting touched in the front all the way together. Great, awesome. Yep, make sure they're equal. Make sure one's not down lower than the other.
Do just a few more. We'll shoot for maybe 20 to 30 reps.
Oh yeah, we're gonna do at least 100, everybody. Ready? And then make sure to inhale as you open, exhale as you close. Take a nice, big, deep belly breath. Yeah, awesome. Looking good, everybody.
All right, go ahead and take a rest. So you might be asking, well, why are we doing a shoulder exercise for, I thought this was for knees. Well, most people you can assume have some kind of shoulder, upper back, forward head posture that needs to be corrected. So we're kind of starting there. We're going to work down just so we address the whole body. So we're kind of, now it's to help with the upper body and shoulders. Now this next one, we're going to have a seat on the floor. Okay, and let me know if this is a good angle, Kelly, but
yeah, you're good.
so you're going to sit. Now this one requires a little bit more flexibility, but we'll do your best. You're going to sit all the way back against the corner on the wall. Now your legs are straight in front of you. And just like when we stood, my feet should be pointed straight ahead, just about, a fist distance between them. And then you're going to do three things. The first is pull your toes back, not just your toes, but your ankle. So flex the ankle. So you should feel some stretch on the backs of your legs, and make sure those feet stay nice and straight. They're not twisting out, or you're not twisting the ankle like that, but nice and flat. And then you're going to lock the knees. So push the knees down, try to keep the back of your knee to the floor. And then the third thing is your shoulders. So I'm just going to put my hands in my lap and pull the shoulder blade back. So you kind of squeeze between the shoulders. So not up, you're not going to shrug, but just pull them back kind of down towards your butt.
I always say, put your shoulder blades in your pockets, in your back pockets. And if you can't get down on the floor for this one, or you don't really have a wall to put your back up against, take two chairs, sit in one chair, put your butt and your back all the way into the crack in the corner of that chair, and then put your feet up on something that's equally the same height in front of you. And it can also be a little lower than chair height too. If you're tight, maybe you need to lower it a little bit, modify the exercise so that you can actually still get the benefit of pulling those toes back and tightening those thighs, but it's just not such a big strain on the back of the hamstring. It's okay to modify things.
Yeah, and this one, there's not really any movement here. You're just going to hold it. So you should feel maybe some tension or stretch on the backs of your legs, maybe some work or some tension on the front of your legs, like your quads or your shins, and then in your upper back and shoulders working just to hold them against the wall. So it kind of addresses the whole body here. But you want to hold that for, we'll just give it a minute, but usually we do this for several minutes if you can.
The Zoom user who asked the question, what if you grip your toes a lot, more so on the left? This exercise will help that.
So
start doing this exercise every day, a few times a day, master it, get really good at it. And I guarantee you the toe gripping right versus left and toe gripping in general will get better.
Right. That's probably good. Let's relax. And now for this last one, you're just going to need a chair or something to sit on that's about a chair height. Probably not a soft couch. You want something a little more firm if you can. And then we use a block. So this is similar to a yoga block, but you could use a pillow off your couch. Or if you have a yoga block, that's great, but a pillow should be fine. And maybe just fold the pillow in half if it's too soft. But we're going to squeeze that with our knees. So the position of this is really important. So we're going to start seated, not in the very back of your seat. So kind of scoot forward a little bit so there's nothing touching your back. And look down at your feet. Once again, make sure they're pointing straight ahead. And the ankle should be right below the knee and the knee right in front of the hip. So you've got this nice 90-degree bend. Okay, and then your pelvis, this is important. I don't know if you can see my black shirt kind of blends in with the black chair, but you don't want to be slouched like this. You're going to actually tip your hips forward, or think about arching your lower back. So your belly button kind of goes forward, places this curve in your back like that. So now my spine is more upright. And then the pillow goes between your knees, and you're just going to squeeze it and then release it. So squeeze between your knees and release about 1 second at a time. I'll give you a front view. So you're just, pushing in and relax. Don't fully relax because you'll drop the pillow, right? But
yeah, don't drop the pillow.
you're gonna feel this in your inner thighs, kind of from your groin down your legs. That's the primary area we're targeting. Let's see.
And try to squeeze the pillow equally. And
Yeah.
think about all three of the exercises you've already done. Did you feel imbalances while you were doing them? Was one side doing something different than the other? Was it squeezing harder? Were the toes not pulling back equally? Were the elbows and the arms not moving in the same direction at the same time? Was one side tighter? Those are all such big posture cues, insight into your imbalances and what needs to be fixed and changed over time. And as if you continue to keep doing all three of these exercises and go for balance on both sides, you're going to change the posture every time you do these exercises and balance the body out over time, day in and day out. So the beauty about Egoscue too is also that all the equipment that we have and use is basic things you can find in your house. So you can do them anytime, anywhere. They're so applicable, no matter whether you're traveling, you're home, in the airport, camping. I just did a session with a woman. They live out of their, Sprinter van up near Mount Hood. And she had her yoga mat out on the ground, and I did a full session with her on Zoom from her Sprinter van and Wi-Fi up on Mount Hood. And it was awesome.
Cool. All right, so it's probably good enough pillow squeezes. So let's all stand up again and maybe shake it off a little bit, and then let's reassess, see how our balance in our feet feels now. So just once again, relax, put your feet wherever they feel natural. Close your eyes if you want to, and just tune into your feet and what feels different. If before you were feeling a little more on one side or more on the front of your feet, did that change? Where is it now? So I know personally for me, I feel much more balanced. Like before I was feeling a little heavier on my left foot. My left ankle tends to pronate more, collapse, and I can feel now both my arches feel pretty similar, like equal weight on the ball and the heel and not so much there. So, but let's hear from some of you. What does everybody else feel? Anything different?
I actually thought I was pretty balanced, but now I felt a little bit of weight in my heels before.
Mm-hmm.
I didn't think it was abnormal, but now I feel no weight at all in my heels.
Interesting. Yeah.
Yeah, great insight. Way to become your own posture therapist. I love it. And why is this important? Why is this important that we know where our weight distribution is in our feet, right? It's something that we're trained not to be aware of in our society. Everything's trained us to tap out of our body, tune out. And when we tune in, that's where we get all the information to help us get ourselves well. And so when you work with a practitioner, it's really about you gaining that kinesthetic awareness, gaining that empowerment over your body again, and being able to interpret the signals and understand it and trust it. And then we build a program of exercises to help, rebalance the body, rebalance the posture. And then it's just, then the function and balance and strength come when you set that posture foundation underneath.
Yeah. Did anybody else feel anything shift, anything different from doing those exercises? It's okay if you didn't, like I said there.
Yeah, more balance across the entire foot and balance between the 2 feet.
Oh, nice. Great.
And if anybody had knee pain, did it change your knee pain when you walked around or when you stood up or when you got up and down? Did you feel any difference?
because it can happen that quick, and you'd be surprised. It doesn't take much sometimes, not for everybody, but sometimes just a little shift in your posture is all it takes to take that pressure off your knee. So
On the sitting on the floor pose, I felt pain in my calves and my toes from trying to stretch.
yeah, probably pretty tight then, huh?
Yeah, I've always had tight calves.
Yeah. How did it feel once you stood up after doing everything?
I guess I didn't pay attention, but yeah,
Well, it probably wasn't hurting then if you didn't notice it, at least, right?
no, it wasn't hurting. No.
Okay. Yeah. Okay. Well, great. Those are just wanted to show you guys some examples and how quickly, your body can adapt right away. Several people felt more balanced in their bodies and just by 3 simple movements. And those aren't even necessarily specific to the individual, right? So whenever we work with people one-on-one, we can obviously look at the posture, look at the whole picture, and then have exercises that are more specific and really targeted to your specific issues. So
Modification is a big part of what we do, depending on people's postures and pains. Yeah.
Yeah, so I know we're just about out of time here, so just going to share one more thing about what to do next. So now that you've learned a little bit about what we're all about and how it works, you may still be skeptical, which is totally fine. If you're brand new to this and you still want to learn more, and maybe I think the best place to start would be from the mouth of the founder of this method himself. So the book Pain Free, and there's actually a new edition that came out just less than a year ago. You can get it on Amazon, or do I have the link here? No, but if you just Google Pain Free Egoscue or go to painfree.com, you can order the book. And it talks obviously more in depth about the method, how it started, how it works, and why. And there's a chapter dedicated to each body part. So you can go straight to the knee chapter or the hip chapter or the back or the neck, whatever issues you're dealing with, and get some ideas there. So really helpful book. So I recommend everybody get that, regardless of your situation. I think it's helpful. You may also be feeling like, okay, this is kind of making sense. Maybe I felt some changes today just doing those 3 exercises, but my case is kind of unique, or I don't know if Egoscue can help with X, Y, or Z. Well, we're here to answer your questions and help. So we're offering a free posture evaluation to anybody on the call who wants to. And what that looks like is, as it sounds, we'll evaluate your posture. We'll look at your body either on Zoom or if you can come into the clinic. But we'll take your pictures, talk to you about what we see there, help you understand what's going on, and then just to give you a little bit more insight into your body. So
how your posture is related to your pain and the limitations you're experiencing.
Yeah,
help you turn on those light bulbs.
Yep. So it's not necessarily we're going to prescribe exercises or anything, but it's just kind of a starting point. So that's usually like a 20 or 30 minute free eval that we're offering. So, and then the third option, of course, is if you're on board and you want to begin your transformation, just like some of these examples we showed, and you're excited and you think this could really help you, then we want to partner with you to help you get there. And so we have a couple different packages that we offer. I'll put them here. And as a thank you for attending today, if you sign up in the next week, then we'll give you a 10% discount off our normal price. So you can see down there what that adds up to. We got a 16 session package or an 8 session package. And you can decide after going through your first session with the therapist, what makes the most sense for your situation. But, it's a process. Most people didn't get into chronic pain overnight, so it's not going to change or completely get better after one session. So we offer packages to really take you through, getting you straightened out first is the main goal, and helping the pain go away. And once that happens, then we need to start strengthening again. And you're going to start feeling like you want to be more active. Maybe you've given up running or hiking because of the knee pain. Well, now the knee pain's gone. You want to start getting back into that, right? So we just need to make sure you're strong enough in your new posture to be able to do all those things. And then it's just about maintaining it, getting to that point where you can do everything you want to do. And then you will have to continue doing some form of exercise to keep those benefits as you continue to age and be active. So that's that's typically what we do in the 16 session package. The 8 session package is a good start. Most people will feel significant changes in those first 8 sessions, and most of the pain could potentially be gone by that point, but that's just kind of what to expect. And so practically speaking, we first appointment, usually about an hour and a half, and then you do your exercises on your own each day. And we typically follow up once a week in the beginning. And then as you progress and get more into those later stages of getting out of pain, then we won't need to meet as often, typically start to space it out, and then eventually just coming in as needed to check in and, make sure you're still on track. So, oops.
Everybody's program looks different because everybody's posture is different and everybody did something different in their lifetime. So it's not a one size fits all approach. And that's why it's really effective. And that's how we're very different from all other modalities, specifically medical modalities as well. And I was going to read Jan. She shared an unsolicited endorsement. She said, I've been doing Egoscue nearly daily for 6 months. Within a few weeks, my knee straightened after at least 50 years of turning inward. I've had several other changes that I did not even think were possible at this point in my life. She reveals that she doesn't always love doing her exercises every day, but she's convinced it makes a huge difference in the experience of her body and her daily life. So she continues to do them every day. Thanks for sharing that, Jan. I really appreciate that.
Yeah.
As therapists, we always like to hear, people coming back after 5 or 10 years saying, I'm still rocking, I'm still doing my exercises, I'm out living my life and, I'm thriving. So thanks. We love to hear that.
Yeah, awesome.
It's been great.
Oh, thank you, Jan.
So this is our contact info. You can also just go to egoscue.com and search for the nearest clinic. But we're here to help. And as Kelly mentioned, we can work on Zoom too. So I know a lot of you aren't necessarily nearby, but okay.
And that's okay.
Yeah, we work with, at least, especially during the height of the pandemic, we were working a lot with people on Zoom. And now it's just easy to work straight out of your home. There's no real need to.
No need to fight the traffic. No need to stress out. It's very highly effective, whether you're in person or on Zoom, and we're professionals at it at this point.
Yeah.
Say, I'd like to just give my testimony of 25 years ago. I went to the Egoscue Clinic in San Francisco, and I have followed the exercises. I can't even tell you how many thousands of dollars I spent before on chiropractor, and I have not been back to the chiropractor since I got these exercises.
Wow.
It's been amazing
Awesome.
for me. I've shared with so many people. I don't know if they've contacted you, but it really works.
That's great. Yeah. Well, we appreciate it. That's thanks for sharing. So does anybody have any questions about anything that maybe didn't get covered in the workshop? Or you can also contact us individually if you don't want to speak up now, but last chance before we sign off.
I have a question. This is Yvonne.
Yeah, please.
I've been working through the exercises, and it's so funny. I just came online to see if I could make an appointment in person, and then I saw you were having the seminar. But I've been doing the exercises for quite a while, but I would like to make sure I'm doing the right ones. I noticed that in the book, the exercises are quite static, the holds, and then when I do things, find things online, they're very active. Could you explain why the book, which is sort of, I consider the classic, why it is static, or it feels more static?
Which book are you working with, by the way?
Pain-free.
The original one or the new edition from?
It'd be the original.
Okay.
What's the difference between the updated version? Because I also have the original.
Yeah. Well, I mean,
Yeah.
the exercises are different. But I mean, the main difference is just, the original was written in the 90s, right? And now the world's a little different. I think in general, our population is different. Like the people that were coming to Pete back then, it was just the one clinic, in San Diego, I think had different problems. The posture was different. Our lifestyle was different back then. And so now 30 years later,
posture evolves over time. in
Yeah.
a population and in a person and in a community. So the exercises have to evolve over time as well. So that's why the method, you know, it looks very different today than it did 20 years ago. And it should.
Right.
Yeah.
right.
So
Mhm.
I think that explains some of it, why some are more static than others. I mean, we do a variety of both, honestly, like in the clinic. So I don't know if there's one is necessarily better than the other. It's just kind of depends on what you're trying to address. So there's several hundred different Egoscue exercises that we use. The book just has a small portion of those. So yeah, I don't know if that answers your question or not.
Yeah. And I think what it all boils down to too is that you have to do the exercises that feel best for you and meet you where you're at currently right now with your current posture imbalances and limitations. And that can be hard to decipher on your own. Most people come to us because they're just not quite sure which exercises to do, how to do them, which ones to pick, which book, which, you know, video. And when you come in with us, you know, we'll work one-on-one and we'll pick the right ones for right where you're at right now. That's our job. That's what we help you do. And then over time, you just become so empowered with the tools, the exercises as the tools. And then you start to write your own programs and rearrange your exercises and do them the way your body wants them. And you just take ownership of it. And those tools, those exercises become a skill set for a lifetime that you can use from now until forever. And you don't really need us anymore at a certain point. You're going to be like, I got this. I totally understand my body. I know what it's doing. I know how to interpret it. If something pops in, I know what exercises to use, when and how. And, you know, that's really the method, is just being able to go into your body every day, ask it what it needs, and give it the exercises that it needs to thrive and do all the activities that you want to be able to do. There's no magic bullet, a magic set of exercises that I'm going to give to you that are going to be the perfect prescription, because, you know, your body is the expert, and your body knows, is so full of wisdom and knows exactly what it wants and needs. And so it's our job to work together to create that program for you and work you through straightening and strengthening your body out of that old posture into the new aligned posture, and getting more functional and building that strength to get to your goal.
Thank you.
Hopefully that answered your question. Any other questions? Maybe 5 more minutes.
Done.
Great questions, by the way.
Well, we'll be sending out this recording, by the way, to everybody who RSVP'd. So I know there were some people that couldn't join us, or if you have friends or family members, you know, who could benefit from this, you can forward it to them. You know, share the knowledge. But
Yeah.
Thanks everybody for joining us, and we'll hopefully be hearing from you soon. If you want to sign up for the free eval, or your sign up for some sessions, or even just to answer any other questions, we're here to help. So
yeah, don't miss that 10% off. And I know there's an expiration date for that too. So look for that in the email. And if you have any questions, we're here to help. We're your support team. Like, lean on us. We want you to call us, email us, you know, reach out. Don't leave any stones unturned. Get your questions answered, because we want to make sure you're on a plan and you're moving forward and you have a path going forward, getting support and help.
right. Okay. Thanks everybody.